everybody, and welcome to another UIC Urban Health Club video. Today we're doing a public health series with our focus on civic engagement. And the information we're pulling most of our stuff from is the Civics Independent Project, COVID-19 Crisis Consultant for the community from the CPS, Remote Learning.
All right. First, we're just going to do a little review of the basic COVID-19s. This might be repetitive, but it's important that you guys still know the information for COVID-19 because sadly it's still present. So let's just go over it. So the first one it causes mild and severe respiratory illness in people. Thus, that's why we need a respirator when people are in the hospital. Some signs and symptoms may include fever, shortness of breath, fatigue, cough, sore throat, and loss of taste or smell. People who are asymptomatic can also be infectious. Now, I don't know if you guys remember, but asymptomatic means people that don't show symptoms. And then risk factors include people that are over the age of 65, are obese, and have existing medical conditions. The reason why is because these people tend to be more vulnerable to COVID. Some other things would be transmission is via respiratory droplets. That's why we say that you guys wash your hands frequently and as well as always wear face masks. There's no specific treatment as for now. Diagnostic tests are done to test people who show the signs and symptoms. Antibody tests also shows that if you have been infected with the virus in the past. All right, so now we're just gonna watch a video about how the flattening the curve works.
Math can show us the future of the coronavirus. Here's how.
At the beginning of an outbreak, because it's a new infection coming into a population, pretty much everyone is susceptible to infection. So when you're infectious, pretty much everyone you meet, there's the potential for transmission to happen there. And so, for example, the first person might infect 2 people, each of those might infect 2 people, each of those infect 2. And so we have exponential growth. So the curve goes upwards and it gets steeper over time.
That example represents an R0 value of 2. An R0 value, or reproduction number, explains how many people a single person can infect. But changing the R0 value up or down can significantly impact how a disease spreads.
The high R value is going to give you a faster growing curve, and you'll see a higher peak, but also it'll burn through the population more quickly. A medium will grow not as quickly, the epidemic will last longer, and then it'll decay away. And the slower R0 would have a slower burn through the population, you would have a lower peak, but the epidemic would last longer.
That's why the term flattening the curve is so important. Actions like social distancing will create a slower, longer curve that's better for our health system. However, it could also negatively impact our economy. But if we can keep the R0 value below 1, we can get the outbreak under control.
All right, so that's the whole purpose of that gives out an example of the different types of curve. And obviously we want to be in the lowest curve. The reason why is because there's less deaths and we are able to accommodate more people during that long period of time rather than just a short period of time. So incubation periods last between 2 to 14 days. Infection period begins 2 days before the start of your signs and symptoms and can last up to 10 days after the illness you had the COVID. People can transmit the virus during infection period. That's why it's important for social distancing. Asymptomatic people can also be infectious. This is why quarantine and social distancing are important. So I hope, even though stores are still being open today, I hope you guys are still practicing social distancing. I know it's extremely hard knowing that you might have friends going out and there's more people out and about, but just remember that we still have COVID within our lives right now and we still don't have any treatment so far. So please still practice social distancing and please always do proper hygiene and always wear masks when you guys go outside. All right, so this is another video about how it could spread in your community.
Hello, I'm Dr. Isaac Genai. I was part of a team that authored an article published on April 8, 2020 in CDC's Morbidity and Mortality Weekly Report, which reveals important new information about how COVID-19 can spread in a community. Large family gatherings can be a way to spread COVID-19 in communities, as illustrated in the cluster of cases detailed in this report. Patient A1.1, the initial patient in this investigation, was part of family cluster A. Patient A1.1 was the first case and represented the first transmission generation. In February 2020, a funeral was held for someone who died of non-COVID-19 causes. A close friend of the family, patient A1.1, shared a meal with members of the bereaved family, family B, the night before the funeral. Patient A1.1 had recently traveled out of state and had mild respiratory symptoms. Patient A1.1 had close contact with members of family B at the funeral. 3 members of family B developed COVID-19 symptoms in the days following the funeral. Patient B2.1 was hospitalized. Patient B3.1 developed symptoms days after embracing patient B2.1 while at the hospital, while not wearing personal protective equipment or PPE. Ultimately, patient B2.1 died on day 28. 3 days after the funeral, A1.1 attended a birthday party with 9 other members of family A. 7 party attendees then developed symptoms of COVID-19. 3 were confirmed to have COVID-19, and 4 others were diagnosed with probable COVID-19. Patients A2.1 and A2.2 were hospitalized and ultimately died. 1 family member and a home care professional developed probable COVID-19 after providing personal care for A2.1 without using PPE. Patient A3.1 likely spread the disease to patient A4.1, a household contact who did not attend the birthday party. 3 birthday party attendees with probable COVID-19 attended church 6 days after developing symptoms. Patient D3.1 developed COVID-19 following close contact with these patients at church. This cluster ultimately resulted in 16 cases and 3 deaths, and highlights how quickly the virus can spread in the community. Staying home and avoiding large gatherings are key to slowing the spread of COVID-19.
And as you guys could tell, this video was it was just showing you basically who's around within your family. So it wasn't really like, it could be friends and but it was mostly, it started because you guys were or because that person was hanging out with families. So it's, I know oftentimes we think that we don't have it, but that's the reason how it spreads. So we often, when we go out, we have to act like we have it. So that's why it's important that we wear proper PPE and we do social distancing. All right, so if you guys take out a piece of paper, we're just gonna do a little activity. So the first one would just be write 5 sentences describing your current understanding of COVID-19 crisis right now. So it doesn't necessarily have to be health related. It could just be addressing your education, transportation, economics, any of those things. So for me, my education right now, I'm in summer break, so I guess I don't have any for that, but I still do research. So I guess I could do, I could write down a little bit about how my research necessarily has been affected by COVID-19. So obviously I do research at home. So that's definitely different than it would have been if I would have actually done it with my mentor face-to-face. Economics, so thankfully I am doing well. However, due to, I guess, I get that, I don't know if you guys experience this too, but my food nowadays sucks. Like, I want some good food, but I'm scared to go out, and buy that good food. So I guess I can write down how my food has sucked so far. So just like things like that has and how COVID has affected any of your like daily lives. It doesn't necessarily have to be health related, like I said. So the second part would just be write 3 questions that you still have about the crisis. So for me, it could be, is there going to be a vaccine coming up soon? And I currently saw in the news that they're still trying to push it out as fast as they can, but it's still not here. Another question is this overall COVID-19 the situation getting better? And unfortunately, it's not getting better. So just some questions like that that you guys might have about it. And you guys could also email us about your questions, and we'll be happy to direct you to some research, or we could do the research on our phones to give you the answer. All right, and then the last one would just be write 5 sentences detailing about what your civic and social life means to you and the ways in which you think it has been or could be affected by COVID-19. So definitely, I know everyone's social life has been affected. That's for sure if you guys practice proper social distancing. And just write a little bit about that. It definitely does help vent out any frustrations that you guys might have.
Okay, now we're going to move on to activity 2, a first part of activity 2. So in this part, you're going to be given 4 different articles, and the goal is for you guys to review those articles. They're pretty short, just news articles, and think about the main focus that those articles are about, so the main idea. And then we'll go over each of them in the next few slides so you guys have an idea. So starting off with document A. So document A was basically focusing on these 4 terms that you guys see on the screen: quarantine, isolation, shelter in place, and stay at home. So the article was basically going over the difference between these two and some examples and situations that they can be used. So for example, starting off with quarantine, they gave a definition of like, it's used for people who think they may have been exposed to somebody that has had the virus or at work. So the quarantine aspect comes to that they're going to be restricted from activities in order to prevent further transmission. So an example for that would be such as if Diana would have came from China, for example, from Wuhan, China, and I had contact with her, then I would have self-quarantined myself in order to prevent any further transmission at my work or at school and stuff like that. And then moving on to isolation. So the article described it as when people who have had the virus or know that they're infected isolate themselves, so separate themselves from people who have not had the virus. And this is seen like in hospitals. Certain patients who have had the virus are kept in areas in the hospital to prevent other patients who are coming for other reasons to be infected with the virus. And then we have shelter in place. So shelter in place and stay at home have been 2 terms that we have seen like in the news. Governors around the country have used it. But typically shelter in place is used for emergency situations. So in the article, they use an example of if there's an active shooter alert, then the authorities will use shelter in place so people can stay in a safe indoor location until the situation is resolved. So that's typically what shelter in place is used for, but we have seen it used during this pandemic, similar to stay at home. So for example, here in Illinois, our governor used stay at home, which means that people are advised to only leave their house to go to essential places, such as groceries, pharmacies, if they need to go doctor visits, if they're essential workers, things like that. That's where the stay at home term comes into place. So that was what document A was mainly focusing on. Moving on to document B. So document B was a website link to the city of Chicago, and they provided COVID-19 resources. These are just 4 of the main topics that they had, but they also had other ones. So for example, they had a category with health resources. So they provided people with community health centers where they're located in the Chicago area. Also different resources for free mental health help for people that may need it. So that's the health aspect, and those are just a few ones. They had more. Next, moving on to the food. So they had the link to the Chicago Greater Food Depository, where people can find a local food pantry by their home, and that's a goal to help combat food insecurity in communities happening today. And then for housing, they had resources such as the rental assistance program. So people who are struggling to pay their rent or mortgages, they had help for those as well. And then for the schools and youth category, they included the Chicago Public Schools and Chicago Public Libraries, online resources that are currently available for students so they could complete any work that they may need during this time. So those are just two of the documents, and then now we're going to move on to the last two documents.
Hey guys, so document C kind of goes over, it's a short video done by BBC News, and they kind of go over how China recovered from the epidemic or the pandemic. It goes over how they kind of, dealt with it. As many of you know, the virus originated from Wuhan, China. So it follows the steps that they've taken. It kind of gives you like an international perspective. Not only can you compare and contrast what what some of domestic policies we've been implementing, but we could also analyze international policies as well. The next document is kind of the recovery plan for COVID-19 and how it could lead to, different consequences related to our economy. As you guys know, a lot of, since people are not going out, people are not really spending a lot of money right now, and local businesses or even, big businesses, I'm sure many of you guys have seen a lot of businesses being closed down, or kind of relief efforts for local businesses that could have, if this happens for like a prolonged period of time, it could cause like economic consequences, but this also influences kind of like social issues as well. So, education, access to different grocery stores, or, you guys might not think that it might affect you, but in reality, the economy revolves around everybody, and everybody's affected by it. So you guys can go ahead and watch that video if you guys would like. The next document is document E. So this is, these are two links that will give you guys access to the ward maps. So different, so Chicago, as you guys might know, is split up into 50 wards. So each ward is run by an alderman, and they are elected to serve a 4-year term. So if you guys don't know who your alderman is, you could easily look them up or look them up. So what we want you guys to do is we want you guys to download the map of your ward and kind of look up the different aspects of your community, see what, where your grocery stores are located. I mean, I'm sure most of you know where they are anyway, but there might be some clinics or parks or even libraries that you might not know about. So we want you guys to see the bounds of your ward and see where different local businesses are. So the next slide, we want you guys to kind of reflect on all these documents that we've shared with you. Go over, write 3 passages about what stuck out to you. What did you learn mostly? Like I said before, that the crisis video on how Wuhan, China kind of responded to the pandemic might be a good source to compare and contrast, like domestic policy versus international policy, and just to see how China dealt with it, being the first nation to be struck with the virus. If you guys have any questions about it, write those down. You guys could always email us. If you guys need more resources or access to anything like that, let us know. In the next slide, we want you guys to identify 2 people in your community that are somewhat of leaders in your community. So it could be a religious figurehead, it could be a principal, it could be a librarian, someone in your community. we don't want you guys to go out and meet with them physically, but maybe set up a phone call interview or even like a Zoom call, and you guys can talk about what some of the questions you guys still might have, or some of the things that you're curious about. And then, like I said before, figure out who your alderman is. A lot of aldermans right now are setting up programs to not only clean up the city, but also are giving access to different resources, like Vanessa was saying, different food drives, different pantries that are opening up. So we've attached a document where you could look up your alderman based on your ward as well. And then we can go on to the next slide. And I think this one, we're going to be talking about the primary sources and how we can put it together. So this one is kind of talking about the same thing, how the documents are kind of related to each other. Like I said, if you guys have any questions about it, or you guys are curious about it, go ahead and contact those two community leaders, or you guys can contact us about it as well.
All right, hi. So after activity 3, now the things that Donnie mentioned, we're gonna be moving them and putting them together. I recommend to have like sort of like a notebook or a piece of blank paper so that you could write down the investigation and the things that you do find about your community and stuff. So for this activity, so all the information provided, using the grasp format, you begin to sort of like write down some ideas. The grasp format meaning that the G for like the goal of the scenario, or like the thing they want to accomplish or find out more information about. The R, which stands for the role. So like what role will you be playing and what roles will you like to meet in contact, like the alderman or a leadership role. And then the A, which means the audience, as the situation or context, which will be like your neighborhood or the problem. And then the P is just basically the performance or the challenge that you encounter in. So what I recommend is that for everyone to, now that social media is like the main platform to discover or to know relevant news, I recommend definitely to create or join into a community group wherever you do live. I personally live in Beaumont Cragen, and I know that they do have a Facebook group where they post good deeds and something, and every so and then like bad stuff, so that they could put more awareness of having the people's safety and stuff. So I definitely recommend being more involved in the community, as well as group messages, for example, like a block watch or things like that. So for the first activity on your piece of paper, you could always set a goal. So you could write 3 to 5 things that you would like to be engaged in or social life. For example, volunteering at a local library or at a church when they do reopen, or just simply cleaning up the city as well. Then for your role will be just basically maintaining social distances while doing your community civic life. And then if you do need the power of help, you could always go back of what Donnie had mentioned about the ward maps. So you could definitely get into contact via phone call with your alderman or with a leader or community leader in your community. And then for your situation, you could always list down the important things that you've learned or that you've encountered, for example, some challenges that you might have. And then the product will be just basically like the things that you find out and like how you can promote and share with others. We can move on to the next slide.
So this is activity 4, the conclusion. In this activity, you'll be getting a little bit creative. So you might need some markers, crayons, and paper. So you'll be taking on the role of the crisis consultant for your community, and their job is to advise the elder person. Well, your current job is to advise the elder person on how to manage the social and civic activity of in the war during and after the COVID-19 crisis. So you have to consider the audience that you identified in the last activity, question number 3, and create a flyer that will be distributed within your community to reach that audience and promote community commitments for maintaining the social and civic life. So you can draw, you can write, and you can make an infographic with this flyer. And the choice is yours. Then part B, imagine you're preparing for a town hall meeting in the future when the restrictions on social distancing is all lifted. Your job is to write a speech to start that meeting, and the purpose of the speech is to encourage the community to engage in dialogue and planning for moving forward after the crisis, and how to kind of set standards and whatnot. Also consider ideas and issues you unearthed in your investigation. So on the next page, here are some examples of the flyers and such. And at the bottom left corner, there's example flyer sources you can make if you don't want to like draw, physically draw or color and make a flyer by hand. There's, if you click the little here link, there's a little website that helps you make your own digital flyer. And for your enrichment or extra stuff, if you feel like you want to do so, you can share your flyer and speech with your alderman's office or tweet at CPS Civic Life on Twitter. Also, you can create a proposal for possible policies that could be introduced to correct structural inequities that you uncovered in your investigation, because you never know, they might have never thought about what you found in your investigation, and it might be of some help.
So now, after having done all these activities, we want you to think about a few things that you decided to do. So like, why did you choose the information to put on a flyer, and like use the example or the examples you found from looking things up of why it supported those things, and why did you decide to do the actions you did, essentially. And then you want to ask yourself, like, who has the power in democracy? Why do they have it, and how do they use it, you know, and how you yourself can exercise that power as well. So, and then on the next slides, we have additional readings that you could click on the link below to read the packet and have even more information that could help you as well. And following, we have a few terminology that might be useful for your use on these activities and in just day-to-day life. And yeah, so we hope you liked the video. If you have any questions, leave it down in the comment section, and follow us on Instagram at UIC.Urban Health Club.